Good afternoon, everyone, and welcome to YWCA's event, Why Congress Should Declare Racism a Public Health Crisis. My name is Pam Ewan, Director of Government Relations at YWCA USA, and it's a pleasure to kick off today's important conversation. Before we begin, I'd like to make a few housekeeping notes. Today's event is recorded and open to members of the press. All comments are on the record. The presentation is also being live streamed on YWCA USA's social media streams. We encourage you to follow the conversation by tagging at YWCA USA or by using the hashtag YWCA Hill Day. Centuries of racism in the US have created deep inequities in housing, income, healthcare, education, public safety, transportation, food access, and other social determinants of health, with profound negative impacts on the long-term physical and mental health of millions of people of color. Addressing racism will require a coordinated public health response that begins particularly with policymakers. That's why we're proud that today's event is hosted in conjunction with the Congressional Black Caucus, the Congressional Hispanic Caucus, and Congressional Asian Pacific American Caucus, and the Congressional Native American Caucus, all which we're grateful for their support. To kick us off and joining us on behalf of the Congressional Hispanic Caucus is Congressman Jesus Chuy Garcia. Congressman Chuy Garcia of Illinois' 4th Congressional District and chair of the Congressional Hispanic Caucus Racial Justice Task Force is also currently a member of the influential Financial Services Committee. He's also a member of the Natural Resources Committee and the Transportation and Infrastructure Committee. Representative Garcia and his family immigrated to the United States with permanent resident status in 1965. Humbled by his immigrant roots, today, Representative Garcia continues to fight to improve the lives of working-class neighbors and is committed to empowering youth and expanding access to quality education, affordable housing, and economic opportunity, much like the mission of YWCA and its legislative priorities. We'd like to now welcome, and hope you will join me in welcoming Congressman Garcia.
Thank you to the YWCA for the invitation and for pulling this critical event together. Thank you to this year's award recipients and to my fellow speakers. Last year, the COVID-19 pandemic exposed deep flaws in our country. It tore through our healthcare system, our economy, and our housing markets. And communities of color like mine faced a disproportionate impact throughout. The disparities we saw over the past year were not a direct result of the virus. Instead, they revealed what many of us have known and have been saying for decades. Racism is an ongoing public health crisis, and health inequities revealed by this pandemic cannot be separated from it. But what does it really mean to say that racism is a public health crisis? It means crumbling affordable housing, dirty water, and overcrowded classrooms in our communities, in Chicago, in Flint, in Houston. We know that addressing structural racism will require a coordinated response at all levels of government. We need to ensure that all of our work centers around racial equity at its core. But the structural racism we see today did not happen by accident or by chance. It was explicit and codified into law. To reverse this damage, we have to change the law. As chair of the newly formed Congressional Hispanic Caucus Task Force on Racial Justice, I've been focused on creating a framework where the social determinants of health can be addressed. We've got to pass a strong Justice and Policing Act to reform police departments across the country. We've also got to invest in our communities. That's why last month I introduced the Connecting Youth to Jobs Act. The bill not only creates opportunities for youth with barriers to employment to get a job, but it also connects them with supportive services that make it possible to keep a job, like mental health care or child care for young parents. I introduced the Health Equity and Accountability Act in the midst of the pandemic last year to close health disparities driven by race, immigration, and socioeconomic status. But as we act on this moment of racial reckoning, let me be clear. We must also listen and follow our communities, which have been doing this work for decades, and younger organizers and activists from whom we have much to learn. Dismantling our systems requires humility to learn from others and the courage to reimagine our flawed systems. And with that humility and that courage, we will continue to fight for a more just, more equitable future.
Thank you, Representative Garcia, for those remarks, and thank you to the Congressional Hispanic Caucus for those motivating for joining us today. YWCA looks forward to working with you to carry out your call to action in addressing social determinants of health so all can live more equitable lives. So everyone, this was a great way to kick off our program today. And I know you're really excited for what we're going to transition to, which is the heart of our conversation now. So to do that, I'd like to welcome to the stage my colleague, Catherine Bean, Vice President of Public Policy and Advocacy. Catherine?
Thanks, Pam, and good afternoon, everyone. There is a growing consensus among public health experts, researchers, scholars, medical practitioners, and elected officials that racism is a public health issue that requires urgent action at all levels of government. The American Academy of Pediatrics, the American Medical Association, and the American Public Health Association have each issued substantive reports and policies on this issue. Most recently, in April, the Centers for Disease Control and Prevention declared that racism is a serious threat to public health. In making this announcement, Director Rochelle Walensky noted that racism is not just the discrimination against one group based on the color of their skin or their race or ethnicity, but the structural barriers that impact racial and ethnic groups differently to influence where a person lives, where they work, where their children play, and where they worship and gather in community. These social determinants of health have lifelong negative effects on the mental and physical health of individuals and communities of color. And according to our friends at the American Public Health Association, who keep the most up-to-date tallies through their tracking map, across the country, at least 115 cities, 82 counties, and 10 states have declared racism a public health crisis at state and local levels. YWCAs have been a driving force in local and state efforts to recognize and address racism as a public health crisis. This is an effort that we have embraced at the federal level. And so tomorrow, 223 YWCA advocates from 36 states will be meeting with 162 legislative offices to urge their senators and representatives to support Senate Resolution 172 and House Resolution 344, which would declare racism a public health crisis. By passing this resolution, Congress would recognize racism's impact on the broad array of social determinants of health that have contributed to negative health outcomes for people of color. Congress would also commit to establishing a nationwide strategy to address health disparities and inequities, to dismantling systemic practices and policies that perpetuate racism, to advancing reforms to address policies that have led to poor health outcomes for people of color, and to promoting efforts to address social determinants of health, particularly for Black, Latinx, and Native American people, as well as other people of color. Today, I am joined by an extraordinary panel to dive into these issues and explore why Congress should declare racism a public health crisis. And now it's my pleasure to introduce our panel. First, we're joined by Mayor Nan Whaley, who is the president of the U.S. Conference of Mayors and the mayor of Dayton, Ohio. Next is Dr. Altha Stewart, who is the Senior Associate Dean for Community Health Engagement at the University of Tennessee Health Science Center and a past president of the American Psychiatric Association. Dr. Ann Saw is the Associate Professor of Clinical Community Psychology at DePaul University and the new Vice President of the Asian American Psychological Association. Vanessa McDowell is our CEO from YWCA Madison in Wisconsin. And Mark Del Monte is the CEO and Executive Vice President of the American Academy of Pediatrics. Welcome, everyone. To get us started, I'd like to turn first to you, Dr. Stewart, and ask this question. I mentioned in my opening remarks that the director of the U.S. Centers for Disease Control has declared racism a serious threat to public health. Tell us what that means. Why is that important?
Well, first, Catherine, thank you again, and thank you to the YWCA for inviting me again to speak about this very important topic. The reason that is so important is because that's the first step to putting this conversation on the front, at the front of the line, at the headline, the top of the page, which is where it needs to be. It signals that our nation's public health system sees the significance of this, and that from their standpoint, to not address racism is to leave a big gap in what we know as the public health system of the United States. Why that's important is because that gives us an opportunity to recenter this conversation away from the traditional approach we have taken, which is that there are population issues that people have in certain groups that are partly their responsibility and sometimes things that we can intervene on. Those comments in April by the CDC director specifically said there are structural issues in our country that are driving down health outcomes for certain populations, that are creating barriers to those populations, improving their health status, and that there are things, structural things that we can do as a country to improve all of that. And that's really headline news. That's a first for our public health system to acknowledge something structurally baked into, for all intents and purposes, into how we perceive, how we develop, how we design systems of healthcare is what is harming our health.
I'd love to follow up with you, Dr. Stewart. Can you help all of us understand, especially folks who are new to this conversation, when we say racism is a public health crisis, what exactly do we mean by that? You've talked with me before about really systemic racism as a root cause of trauma. Can you tell us a little bit more and help level the playing field for everyone in this conversation?
Yes, I'd be glad to. If you think about racism as being founded on kind of a pyramid, the base of the pyramid is that structurally racist system that dictates where you can live, what kind of employment and education you can have, whether you live in poverty or have an economic standard that allows you some basic needs being met, whether your children can safely play without being exposed to lead or poisons in the soil or other things that compromise our health from the day we are born and sometimes before we are born. And so if racism is the foundation of that pyramid, everything that is built on that, if I'm Black and I live in a poor neighborhood with lots of community violence, where my schools are not good, where the opportunities for employment are poor, where transportation may be essentially non-existent, I am captured in an environment that is bad for my health, no matter where I look. That's those social determinants of health that you mentioned and that Representative Garcia mentioned in his opening remarks. And so building again on that pyramid, now we have a racist system as the base. We have the effects of that racist system on the people who are exposed to it. And then we have the natural course of illness that occurs from these factors, these risk factors. And when you add all of that up, at the top of the pyramid is early death, certain chronic illnesses for which we now know through the pandemic make us more vulnerable for things like COVID-19, hypertension, diabetes, cancer, all of those illnesses that we've all learned and heard about on the news during COVID. The base of our pyramid is what set us up to have those things. So no matter where we turn, health is not looking good for us. And that's based on a structurally racist system. Everything from redlining in residential areas to lack of employment opportunities and all the other social determinants of health dictates where we will land on the health outcome continuum.
So there really is an interplay between the racial disparities we saw in the severity of illness and the higher levels of actually contracting COVID among communities of color and social determinants of health.
There is a direct line causation between the communities people live in based on race, ethnicity, economic status, employment status, and all of those other social determinants. There is a direct line to the poor health conditions that existed prior to COVID that were just a setup for more serious outcomes related to COVID.
And so my last follow-up question to you, Dr. Stewart, again, trying to lay the groundwork for this conversation is when we think about racism as a public health crisis, are there some racial or ethnic groups who tend to pop to the top of those conversations when we think about health impacts of racial disparities in these various different domains or these different social determinants of health?
Yes, some have to do with race and ethnicity and cultural background, if you will, country of origin, if they are immigrant populations. Others have to do with location. Zip code really does dictate your health status. Rural communities often have as high poor outcomes for health as do some major urban areas. And it has to do with access, quality, ability to understand health literacy and understanding how one contributes to having better health, not how one can make it possible in a system designed to thwart every effort, but how one can contribute. Everything from healthy nutrition to physical activity support better health. But there are some factors that are just working against those groups, racial and ethnic groups, rural populations, certain segments within those populations, populations of people where English is not their first language, populations where there are high rates of poverty so that kids come into poverty. And if you start life unhealthy and get no major intervention, it's just going to worsen as you grow and develop.
Thanks so much for helping with that grounding, Dr. Stewart. I'd now like to turn to you, Dr. Saw. As has been extensively reported, we have seen deeply troubling surges in anti-Asian rhetoric, hate, and violence since the start of the COVID pandemic. Everything from racist and misogynistic language that vilifies Asian Americans, to individual acts of violence, and even to the mass shooting in Atlanta that resulted in the murders of 6 Asian American women. Your research with the Asian American Psychological Association explores how racism, hate, and violence are harming Asian Americans, Native Hawaiians, and Pacific Islanders. Can you talk to us a little bit about your findings in these areas and what you've studied?
Sure, I'd be happy to. And I'm so glad to be part of this important conversation. And I want to start by acknowledging that anti-Asian racism, although it's kind of cropping up into our mainstream media attention and into these mainstream conversations, these acts of racism, whether on an interpersonal level or cultural or structural, are not new for Asian Americans. But what you've shared is consistent with our work and that of our colleagues, showing an increase in anti-Asian racism since the start of the pandemic. Our work shows that the majority of Asian Americans have been impacted, whether directly or indirectly, by racism, especially in the context of the pandemic. Racial discrimination is a great source of stress for Asian Americans, with those who experience discrimination directly and reporting to reporting portals like Stop AAPI Hate more likely to be stressed about racism than any other pandemic concerns. And this, of course, isn't to say that Asian Americans have not been negatively impacted. Our work shows all the vast and diverse ways that Asian Americans have, but racism is still a top stressor for Asian Americans. Another key finding from our research is that the vast majority, 3 in 4 or more Asian Americans, regardless of whether they've been directly impacted by racism during the pandemic, now view the US as more dangerous for people from their racial group. And this loss of safety and security is fundamentally trauma. As a population, Asian Americans are experiencing racial trauma that impacts health and mental health, and it exacerbates the negative and widespread impacts of the pandemic. So I love Dr. Stewart's framing of racism as a public health crisis. And another way I like to think about racism as it impacts Asian Americans in this context of the pandemic is in terms of a public health syndemic, interlocking public health crises brought on by COVID-19 with a public health crisis of racism and with long-standing disparities in health, healthcare access, poverty, and other inequities that Asian Americans, Native Hawaiians, and Pacific Islanders have faced, but which have often not been acknowledged. Our research shows how interconnected these are for Asian Americans, Native Hawaiians, and Pacific Islanders. Those who face racism are twice to 3 times more likely to experience current anxiety and depression symptoms. And interpersonal, but also structural racism means that many in our communities have contracted COVID, particularly Native Hawaiians and Pacific Islanders in California, but these often are not reported. We are experiencing a lot of trouble accessing unemployment benefits, finding new jobs, accessing healthcare, including COVID vaccines. And racism and structural racism are fundamentally underlying these challenges that Asian Americans, Native Hawaiians, and Pacific Islanders face. So I think it's really important to include Asian Americans, Native Hawaiians, and Pacific Islanders in legislation declaring racism a public health crisis. That's a critical first step. Our relatively small populations, the lack of careful attention to the diversities within our populations, and the myth that we're model minorities have resulted in decades of our communities being left out of most conversations related to health equity. They've impacted us in terms of inadequate funding to support data collection that then results in misperceptions of a lack of need and overall a lack of investment in our communities. So we need to ensure that Asian Americans, as well as Native Hawaiians and Pacific Islanders, who are even more overlooked, are part of all initiatives to address health disparities. If we're having a conversation about racism as a public health crisis, we have to engage in conversation and collective action to address structural racism that excludes Asian Americans, Native Hawaiians, and Pacific Islander communities altogether, or that pits our communities against Black and Brown communities in a zero-sum game. Our communities are so resilient, and our community organizations have always stepped up and will always step up for our communities. So any congressional action that aims to promote health equity have to partner with these organizations and provide them with resources.
Great. Thank you so much, Dr. Saw. I really appreciate you sharing that perspective with us. It's really important that as we join here together, and I want to pause for a second to recognize this, that racism impacts many different communities of color. There is no single Asian American community. There is no single Black community, Latinx, or Native American community, or one single community of color. Those are broad categories, and there's a lot of subgroups, as the researchers would say, within those broad categories. And so I want to recognize right here that we at YWCA always center as many voices of color as we can in a conversation. It means we are short in every conversation of all of the different subgroups, but I want to recognize here today that we've really tried as much as possible to have multiple voices and perspectives in the room to add to the other briefings that we have done and that we will continue to do in the future in order to make sure that we hear from Native Americans and Latinx representatives of communities and subgroups of the API community as well. At this point, we are working on having a break-in from one of our representatives who got called to a vote, but will be joining any minute now. As soon as she joins, I will definitely call on her. So I want to give everybody that alert. But in the meantime, as we wait for her to join us here in a couple of minutes, I want to go ahead and turn to Mark Del Monte, who is the CEO and Executive Vice President of the American Academy of Pediatrics. And I have to own that I'm a fan of the AAP. My dad was a longtime member when he was alive, and I have a brother who is involved. So I'm thrilled to have you join us here today, Mark. 2 years ago in 2019, the American Academy of Pediatrics issued its first policy statement on racism's impact on child and adolescent health and how it should be addressed. The AAP's policy is part of that growing consensus and recognition that I mentioned at the start in my opening remarks. Can you talk to us for a few minutes here, Mark, recognizing that when Representative Hayes joins us, I'm going to break in, but if you could start and help us understand why the AAP took this action and how important it is.
Thank you so much. It's a tremendous honor to be here with you today. I'm delighted to be part of this very panel, and I'm happy to be interrupted by a member of Congress at any time. So please don't hesitate to do that. I'm Mark Del Monte, and I'm representing 67,000 pediatricians of the American Academy of Pediatrics in my remarks today. Since its founding, the AAP has been committed to addressing the factors that affect child and adolescent health with a focus on issues that may leave some children more vulnerable than others. And racism, without a doubt, is a key issue that differentiates children. We call this, in addition to a public health crisis, a social determinant of health. It is something that goes on outside the clinical setting that impacts the lifelong development of children. It has a profound impact on the health status of children, of adolescents, of young adults, and their whole family. The evidence to support the continued negative impact of racism on the health and well-being of children and adolescents through implicit bias and explicit bias, institutional structures, and interpersonal relationships is abundantly clear. We do not need more evidence about the impact of racism on the life and well-being of children and young adults. So the objective of our policy statement was to provide an evidence-based document that is focused on the role of racism in the development of children and adolescents and its impact on their health outcomes. So by acknowledging the role of racism in the health of children, pediatricians and other pediatrician and pediatric health professionals can proactively engage in strategies to optimize their medical care, to think about the workforce development that is necessary to meet the needs of these kids, to focus on professional education, to engage with systems, and to research in a manner that is designed to ameliorate these health effects.
Thanks so much, Mark. That's really helpful for you to share with us. I am curious, when you think about the fact that AAP, as well as the American Medical Association, APHA, some of the other public health groups have taken this step, can you talk to us a little bit about what you think that should be, how that should serve as a message to Congress about the importance of this issue and why they should act?
Great question, thank you. I think it is really important that health organizations like the American Academy of Pediatrics, like APHA, like AMA, come together to put out policy that demonstrates the scope of this problem. That the stress that is generated by the experience of racism in life starts through maternal exposures in utero, continues after birth, and continues lifelong to create a toxic stress environment that transforms how the brain and body respond to stress. This results in short-term and long-term health impacts on health achievement and mental and physical health. It's important for organized medicine and health organizations to articulate the health impact of racism. This is not a political issue. This is not an altruism issue. This is not anything but a health issue. And so if we are to want the best for our children and the most for our families, we've got to acknowledge that the evidence is abundantly clear. And so we have to take structural steps to change and ameliorate, to change the effects of racism and ameliorate the effects that have already occurred. Let me be really clear that stepping out in front and declaring that a public health emergency is necessary is just an important but first step in a long process that must occur. They must be followed by strategies and actions, and most importantly for Congress, the allocation of resources. We have got to think about putting our money where our mouth is here if we're going to change the systems that affect the life and well-being of kids. We didn't get here overnight, and it's going to take us a while to get there, but we're going to have to put some dollars and energy and time and expertise behind this. It's a marathon, not a sprint. And so we didn't solve smoking overnight, and we're not going to solve structural racism overnight, but we're going to come together, put our arms around each other, and work together to address the systems that are affecting the life and health of our kids and our communities.
Thanks so much, Mark. Really appreciate those thoughts and the AAP's stance on this issue. I'd love to now turn attention to Mayor Nan Whaley and invite you into the conversation, because momentum has, as I mentioned earlier, really picked up at state and local levels to address racism as a public health crisis. And as I mentioned earlier, we've got 115 cities, 82 counties, 10 states that have taken this action at either a local or county level or a state level. And Dayton, Ohio is one of those cities. Can you talk to us a little bit, share a little bit about Dayton's story, what's taken place, and what are the concrete real life impacts that is having in Dayton, Ohio?
Well, thank you, Catherine. I'm really excited to share Dayton's story. And it actually begins in Franklin County and in Columbus, which really in Ohio led this effort to declare racism a public health emergency. And then after the George Floyd murder, organizations really took hold to see what actions we could do. Our public health, Dayton, Montgomery County, has always, in the past few years, looking at public health, looking through racism and equity as a frame for us to make decisions. But for the city and the county to declare is something I think that was really transformational to really organize our whole community around this really important issue. So we did this about 10 months ago. And I think one of the concrete actions that we've seen, for example, in vaccine distribution was one that we can show right away that, here we have a scarce resource. And, if you remember the beginning of the vaccine, before we were trying to get everybody vaccinated, you had to go in order. There were it was hard to get, especially for seniors. And what we did in Dayton is we took 25% of all of our vaccines and set them up aside for our Black community. We worked them through connections in the community, so church secretaries or other groups, so that way we could really make sure that they were really only for Black people in our community. And I think that's the way you have to think about to really attack racism as a public health emergency. We just say, oh, there's so much available in a scarce resource. Are you willing to take your scarce resource in a community and put a portion aside for the community that has equity issues? And so I think that is the thing that's been so important for our community. And I'm really proud of it. I'm proud of that work. And I think it has made a difference in our state. Dayton leads state in actually vaccine distribution to African Americans, because I think of this frame that we have decided to really work through by declaring racism a public health emergency.
Thank you, Mayor. A follow-up question for you. If there is momentum at city, county, state levels, why should Congress take action?
Well, look, I think it's really key for Congress to take action because that helps align this work. There's only so much that can be done on the ground. And frankly, you know, our state has a lot of say in funding for, you know, social services, roads, and really a lot of different broadband. I could go on. And our state is not going to move on declaring racism a public health emergency, right? So there will be states and communities that miss out on this frame without federal action. So I think that's really important. Secondly, those local communities that have declared this, or the state legislations that have declared this, that gives them a partner in the federal government to really work forward in this work. So I think it's really important that Congress does decide to take this step. I mean, and it makes sense. I mean, every health outcome that we see, particularly in our community and in the state of Ohio, we see that Black people are behind. And that is intentional, as the doctors have said. And so we have to be intentional the other way to make sure that our communities actually become more equitable.
Thank you so much for that, Mayor. I couldn't agree more. My next follow-up question for you, Mayor, is, you know, Mark mentioned this, the APHA, and we certainly at YWCA agree. The APHA has said this as well, that declarations are an important first step in a movement towards equity and justice, but that they have to be followed by resources and strategic action. Can you tell us a little bit about what those next steps look like, or what's on the horizon in Dayton or across the state of Ohio in terms of next step to really give some real punch to that, the declaration itself?
Right. So we haven't made great progress in the state of Ohio, frankly, and the Ohio legislature has been pretty terrible at this issue, if I want to be really honest about that. So it's on local communities in Ohio to move on this. And I've really been impressed with the number of local communities that have moved. Look, I think in Dayton, I can give the example. We're big believers of the collective impact model here on the ground. And so when we declared racism a public health emergency, we're starting to create that backbone through public health of bringing all different community groups, nonprofits, businesses, government together to say, okay, we've declared this. What are the actions we can take in criminal justice and education and health, in our housing policy, and put it through the frame of a race equity frame. That, I think, with the collective impact model is a great way forward for local communities. And I'm really want to commend the YWCA. You know, they've had webinars. I've been on webinars from other communities across the country where YWCAs are like on the ground driving their governments to do this. And the excitement around that has been palpable. And I think it's the great leadership of this group that's continuing to move this conversation on the ground. But federal help would be really, really, would really just make this really take off if we could get federal support in this effort.
Thanks so much, Mayor. I understand that we are almost ready for Representative Hayes. Apparently, just as our program started, a number of votes were called, which is the way Congress works. And when we are not in a virtual environment, when we're live, you just see the Congresswoman walk in the door, we have them talk, and then they leave. So we're going to be accommodating that virtually any minute now. And as soon as if we're ready, are we ready to go? We are ready to go. Great. So next to the virtual stage, I am incredibly excited to welcome another YWCA champion of women and communities of color, and that's Congresswoman Jahana Hayes of Connecticut's 5th District. Representative Hayes was elected to the House of Representatives in November 2018, making her the first African-American woman to represent the state of Connecticut in Congress. A teacher by trade, Representative Hayes continues to speak out on behalf of all students as a member of the powerful House Education and Labor Committee. Congresswoman Hayes continues to commit the same energy, determination, and work ethic she demonstrates in Congress to her role as a primary sponsor of House Resolution 344, the legislation that we're discussing today. So please join me in giving a warm YWCA welcome to Representative Jahana Hayes.
Thank you. And thank you so much for inviting me to join you here today. I'm so excited that you are centering your briefing on this very important topic. We've seen the effects of systemic racism on our healthcare system over the last year, and many of the things that we already knew to be true have been exacerbated. Last year in July, I introduced a resolution declaring racism a public health crisis as a result of the data that we were seeing coming in and the disproportionate impact that COVID-19 had on communities of color. We saw that the rates of death, the rates of hospitalization, and the rates of people who fell ill to this virus were magnified and multiplied in our minority communities. So I introduced this resolution last year in July and then reintroduced it this year in April. The resolution acknowledges the history of racism and discrimination in our healthcare system and the systemic economic barriers that people of color face. We did a lot of work to try to improve access to community health centers, accessibility, affordability during testing, during getting the vaccine out. All of these things were very important and really punctuate the work that we're trying to do. This resolution also encouraged concrete actions to address health disparities and inequity across all sectors. I was very excited to see that my own state of Connecticut acknowledged that racism is a public health crisis, as well as the CDC, and it really just solidifies the work that we're trying to do. As we round the corner on this pandemic, I think we have to take the lessons learned and make sure that we are codifying into law funding and programs and legislation that make sure that people who suffer disproportionately from these chronic illnesses have access to health care. Today, in my hearing, we had a hearing in Education and Labor, and Secretary Bakara of Health and Human Services came before us. And one of my lines of questioning was the flat funding of the Office of Minority Affairs. We have to make sure that we are increasing funding in these areas, making sure that we are making room for research, for delivering services to people who need it, and making sure that the communities that are hit the hardest by health conditions have the resources that they need. So I'm so excited to hear that of all the things that you could be centering your work around during this very important briefing of your members of Congress, that this is something that you've decided to center your work on, because we have to make sure that our communities are healthy and have access to everything that they need. So again, thank you so much for having me. And you're right, we are in the middle of a very long voting series that was just called. I think this is the second vote of 7, so we'll have a late night, which hopefully will be ended by finalizing the vote on making Juneteenth a federal holiday. So there's a lot of good work that we're doing. And a lot of that work centers on the lessons that we've learned as a result of the COVID-19 pandemic. So again, thanks so much for having me.
Thanks so much, Congresswoman. And we really appreciate your time in joining us, and best of luck with this marathon set of votes. Thank you.
Thank you.
Perfect timing here to queue up Vanessa McDowell, who is the CEO from Madison, Wisconsin at the YWCA there. Vanessa, it's so great to have you join this conversation. You are on the ground in Madison, Wisconsin, and which, like in the YWCA there, like many YWCAs across the country, has a long history of leadership on racial justice issues in your community. YWCA Madison is very well known throughout the community and across the YWCA network for your racial justice trainings, restorative justice programs, and for your leadership in these areas. And being on the ground in a state and county where there's been a declaration passed to declare racism a public health crisis, I'd love to bring you into this conversation to talk a little bit about what you see that has changed as a result of the declaration being passed and the attention of policymakers being turned in this direction.
Sure. Well, first, let me thank you for allowing me to be a part of this panel. I'm very excited to hear and listen to this great conversation that is needed and that we need to continue to have. But, you know, here in Madison, Wisconsin, we do have a governor that basically declared racism as a public health crisis, and our county did as well. But I do want to give a shout out to Milwaukee, Wisconsin, because that is where it kind of all started in Milwaukee, taking that leap and leadership of starting sort of this declaration sort of around counties that has now spread far and wide. But here in Madison, I think we are seeing a lot of, I would say conversation, but also I would say a bit of action. I would like to say a little more, of course, but I can mention that we have been, Dane County specifically, where we're located, has been #1 in getting people vaccinated in the nation, which is pretty huge for us to be on the map of that world. So it has been a huge push of nonprofits like ours and others that have been committed to making sure that this vaccine gets to communities of color specifically. So we, YWCA Madison, have definitely held vaccine clinics already within our building and amongst our participants to make sure that they have access to the vaccine and have it at an equitable way. I think also one of the things that we are also seeing is history being made here. This last local election, we had an unprecedented number of people of color that ran and won their elections. So another, I would say, sort of outpour of what's happening in our city specifically is sort of a change of the guard, a change of leadership that is more reflective of our community. And so I see that sort of as also a result of us declaring racism as a public health crisis and people really wanting to get involved and really change the narrative around that.
Great, thank you so much. When we think about, advocating for real change that will make a difference in the lives of people of color, do you have thoughts about recognizing you don't represent every person of color, but in your community, when you think about this work and taking that racial justice lens to health issues and health equity, can you share with us any thoughts you might have about what is it that people who are directly impacted by these racial disparities really want from that on the ground sense of things, not the policy work that I do all the time. Are there things that you could share that could be insightful for this audience?
Well, I think one of the things that's important is that we are embarking upon Juneteenth, right? So as we just heard, it's sort of running through and hopefully passes to be a holiday, but also knowing that that is a time of celebration of when Black people specifically were freed from slavery. And I think when you talk about people of color specifically and our needs and here specifically in Madison, I think there is a real sort of need to be seen and really see real effort of really what does freedom really look like. And I think freedom for us is really around addressing a lot of these issues that have come up and continue to plague our communities. Specifically, I'm thinking of when Governor Evers here in Wisconsin did make a declaration around racism as a public health crisis. Right after that, we have the attempted murder of Jacob Blake in Kenosha, Wisconsin. And you have him trying to, bring the legislature back into session for a special meeting to pass legislation around use of force, right? But in our community, do you think they showed up? No. And so we have still these huge barriers that we're encountering when it comes to major things that are impacting our communities. So not only the killing of our people, but also voting, right? You think about the John Lewis Voting Rights Act. That's a huge agenda item right now that needs to get passed. And so that also impacts our community in being able to have the ability, when you're talking about freedom, have the freedom to vote and not have these sort of suppressive tactics to stop our vote and prevent our vote. So those are just a couple things that I think are things that are important to us and things that we really want to make sure that our community, and specifically, I would say that our Congress is listening to and getting passed and sort of getting over the politics of it, but just doing what's right. And when you think about getting into a concept of, urgency, right? We always have this conversation about urgency and whether, we're moving too fast or too slow. We're past urgency. We're right now at the state of emergency and really needing to figure out the action plan behind these declarations. So it's one thing, as I always talk about with like hashtags and letters and statements, but what is the action behind these hashtags, these letters, these statements, these declarations. So really looking and pushing our Congress to really make some action steps around supporting our communities of color.
Thank you so much. I'd love to open up to the panel now, because I've had you all hold your questions or comments to one another until we got through this first round of questions with everyone. And then in the next 5-10 minutes, I'd love just to be able to, recognizing that we'll shift our gears a little bit at the top of the hour. I would love to have any additional thoughts that you might have about what Vanessa just said, or any questions that you might have of one another. This is really the invitation to dialogue, if you will. So I don't know if anyone has a thought that they want to share in response to some of what we've been talking about here today. Dr. Stewart?
Yeah, actually, each of the speakers has reminded me of something I think that it's very important from a healthcare standpoint to remind everyone of, that racism as a public health issue, as a public health emergency, as a public health crisis, however it is defined, we all must be mindful from the health standpoint that what we are talking about is not a simple point in time. It is a pervasive, ongoing, unwavering, unending, relentless. I mean, any words that you grammar experts can come up with that say it just doesn't stop, and that these things have a pervasive and negative impact on our ongoing ability. I'm okay today if there wasn't an incident today. If there was an incident today, the cumulative effect from our early childhood right into adulthood is that we keep adding on. It's a piling on process. And on any given day, it is simply too much. It is the final straw. It is where I cannot take any more. And we have to recognize that that kind of ongoing trauma, psychological, physical trauma, takes its toll. And if we are not mindful of that, we have people who walk around barely, just barely making it. And one more thing is the last thing they can take. And whether that ends badly with self-harm or harm to others, whether it ends badly in the ongoing issues around chronic medical conditions, whether it ends badly in terms of people losing hope and giving up on the resilience that people have talked about, and giving up on the fact that maybe the next legislative effort will work. Whatever that is, if it means that we lose people physically, psychologically, emotionally, socially, realistically, then we have to think of this as the starting point that cannot stop.
Absolutely. And I think of this, and many others do, as a pandemic within an ongoing pandemic, and the pandemic of racism and the impact of racism on people of color has been ongoing for generations, and the trauma that results there. And then COVID exacerbates things. I, particularly as a mother, have been very struck by the social isolation that our children are feeling, by the school disruption, by the impact on families of the social isolation, on the economic stress that so many families are feeling. And so that pandemic within a pandemic, and then the future, what that future looks like, especially for our children, and especially for lower income families and for children and adolescents of color who are hardest hit by many of what you're talking about, Dr. Stewart, and the generations to come, the years to come, that it's going to take to address the trauma that they are experiencing right now. I wonder if there's anyone else. Vanessa, I see you wanting to join the conversation here, and then Mark.
I just wanted to, amen to Dr. Stewart, because she just preached the whole word right there. And let me tell you why. Because I personally can even say that I've had to share with my staff in this last year, I am starting to lose my bounce back ability. And what I mean by that is just saying that, we're always, specifically Black women I'm talking about, we're always sort of supposed to be resilient. We're supposed to kind of bounce back from things and kind of, be strong and, all these things. But honestly, if I was being truthful, it's getting harder and harder and harder every day to show up in that way. And I think it's because of all that trauma that we are experiencing and continue to experience, as Dr. Stewart just mentioned. It's compounding, and it's something that does mess with your mental health. It's something that messes with your physical health. And so when you're talking about having to carry that with you every day on a daily basis, the impact of that, that's something that I think we need to really, really, really consider and make sure that we're hearing specifically from our communities of color, because it's hard. And you know, I'm coming from, you know, a more privileged place, right, as a CEO, right? But imagine, you know, being in different spaces of the folks that we serve. I'm in my building right now. We serve over 100 women and children in this building that don't have a place to go but here, right? And to compound that with racism and all the things that you have to encounter when you leave our building. So I just wanted to, you know, testify that, yes, amen to that is something that constantly I'm dealing with personally, and the folks that we're serving are dealing with.
Great. I'm going to call on Mark for one last quick comment, and then I need to wrap because we have a senator joining us in just a few moments. So Mark?
Sure, thank you. I just wanted to amplify the point about intersectionality of all of these issues of COVID and structural and systemic racism on top of poverty, that layer upon layer upon layer. And we were already concerned about the mental health of children and adolescents before the pandemic. And so this has been a deepening, a revealing, and exacerbating effect on kids. This will add on top of each other. And so I think we really need to think about ways to address the mental health concerns as well. Number one, let's get kids back to school. And let's get kids back to school in environments where there are social supports and mental health services around them to begin to reduce the impact of this trauma that layers upon layers upon layers on their lives.
Thank you. Mayor and Dr. Saar, is there any last quick comment you'd like to add as well?
I just wanted
to sorry, I asked you both. Dr. Saar?
Oh, I just wanted to say thank you to Catherine and I'm sorry, I'm blanking on names. Vanessa, I think that you know, personalizing it. We're not just kind of speaking on a panel here, but we are all impacted, and to share our struggles as women of color, that this is, you know, it's a lot that we're taking on now, and thinking about it structurally, thinking about it historically, even as we feel more optimistic about the pandemic, the impacts on our communities of color will be felt for decades to come, possibly. So there's so much that we need to do, and I appreciate being part of this conversation, appreciate us reflecting on how hard this is for us personally as well. This is so important for us to reflect on.
Thank you, Dr. Saw, and thank you as well, Vanessa, both of you, for mentioning that, because that burden that gets carried has to be acknowledged. And if we can't speak it here and to one another, then we end up alone with that, and we don't have a way around it. So thank you both for sharing that vulnerability. Mayor Whaley, any last remarks that you'd like to share as well?
Thanks, Catherine. Look, I think I would just really encourage and thank the YWCA for doing this work both nationally and on the ground, right? So, you know, we declared racism a public health emergency in our community. You know, it was because the YWCA leadership galvanized the community together. And, you know, I think that is living the work of your mission of eliminating racism and empowering women, right? And so want to just thank you for that great work and encourage you all to continue that effort. I think that the ability for the YW to be on the ground locally, but then also push nationally is very unique. And I also just want to say that there's just huge opportunities in local communities to make a difference in this. There are decisions that can be made by our cities that most of them were built under a racist construct, right? And so how we undo that work is long. We didn't get here overnight, but it is meaningful, it is important, and it makes a difference to people today and tomorrow. So just want to thank you all for your great leadership in this effort.
Thank you so much, Mayor Whaley. We are at a moment right now where, as a nation, we've really had our eyes opened in so very many ways, and keeping our eyes open is a challenge because we all get tired, and it's the burden of tiredness of advocating and addressing and bearing the personal experience for many, as Vanessa and Annie have shared with us. But it's also the fatigue of COVID, the fatigue of the news cycle, the fatigue of the times that we're living in, and there's a message I hear in these last statements and in our conversation today that we can't let the fatigue of the moment stop us from continuing to move things forward. As you said, Dr. Stewart, that this can't be that we just pay attention right now and then stop. It's got to be the start of something that continues. And I'm paraphrasing and putting words in your mouth, but that sense is what I'm trying to tap into to really draw that forward and keep us motivated and illuminated. And I hope all of you who are with us here today, whether you are with a legislative staff or are moving forward in your advocacy work or in your own communities. I happen to know my high school debate coach is watching me live right now. So all of you, wherever you are in the United States, that there's a place for you in engaging in this conversation with us. And we could probably continue this conversation for quite some time. I know I could. And I want to thank each of you on this panel, Mayor Whaley, Dr. Stewart, Dr. Saw, Ms. McDowell, and Mr. Del Monte, because you've shared your time and your expertise very thoughtfully with us in this conversation. And please know how much we all appreciate that. At this point in time, we have about a half an hour left in our program, and I'm going to introduce right now, we have a number of legislators still to hear from, and so I hope everybody will stay on past the panel discussion to hear from our legislators about why this effort is so important. I'm going to introduce right now Alicia Rhodes, our interim CEO and Chief Operating Officer at YWCA USA, to lead the presentation of the YWCA Women's Empowerment Award to our two legislative champions. She is first going to present award and speak to Representative Sharice Davids, who we are honoring today. And then when she's done with voting, we anticipate that we will turn to Senator Lisa Murkowski from Alaska. So Alicia, the floor is yours. Thank you, everyone. It's been a pleasure to be with you here today, and I turn things over to Alicia.
Thank you, Catherine. Thanks, everyone, for joining us. And I'm going to take a couple of deep breaths. I think that Catherine may have set me up, putting me at this point in the program after the amazing panelists, and also after Dr. Stewart just dropped an entire word on the any given day. Any given day, it can go bad for the BIPOC community as it relates to just managing how we show up with lack of resources around our mental health and just health in general as part of the deficiencies that we face being a part of this country and the system that we are supposed to function within. And Vanessa, I'm not really sure what you were trying to do with me when you came in with the bounce back ability, but you guys definitely made me have to take some deep breaths and run for some water because you gave me chills, because that is the reality for many people in the BIPOC community. That is my reality. And Vanessa, you're absolutely right. You and I, Sadovich, you and I lead organizations and we lead teams who don't necessarily have some of the privileges we have to do some of the things that we do, and maybe sometimes have some boundaries that we have, and we still struggle. So whether we're talking about the communities that we serve or even the teams that we lead, I just want to make some space in this moment for all of the communities. I want to make some space for the folks that are unheard, unrepresented, and just all of us in this moment in time. We are fatigued. I know that the call is for us to just continue to move forward and continue to press forward, but I want to acknowledge that that is a big task. And the YWCA has been doing it for 163 years, and we will do it for as long as we need to until we can break down these systems and these barriers that stop us from thriving as a community of color. But I want to recognize that it is hard. And as Dr. Stewart said, any given day can be anyone's last day because the resources aren't there. So it is on us, as fatigued as we are, to take the time that we need if we can. If we have the ability to allow others to take the time, to also give them that time to refresh themselves. But any given day is when our communities, we can lose folks in our community. So we have to keep on pushing, but it is hard. So this work is important, but I just want to acknowledge that it is hard and it is also necessary. So, Catherine, I'm off script, but I felt like I needed to say that because I needed to compose myself because of the moment that I had as you ended the amazing panel discussion. Right now, I will move right into the awards. The YWCA Women's Empowerment Award is presented to an individual and an organization who provides leadership to advance women's empowerment to women across the country within BIPOC communities that pretty much align with the mission and vision of the YWCA to eliminate racism, empower women, promote peace, justice, freedom, and dignity for all women and girls. This year, we are pleased to honor 2 congressional leaders for their advocacy on behalf of women and girls and Indigenous communities, and for their unwavering commitment for survivors of domestic and sexual violence. Today, we're going to start with honoring our Congresswoman from Kansas,
Actually,
the 3rd District.
Alicia, we had the vote ended early. My apologies. We need Senator Murkowski has joined us, so we're going to start with Senator Murkowski. Sorry about that change in program.
If we are nothing but flexible and we are great pivoters, we are here and we will start right over. So thank you so much for joining us, Senator Murkowski. We really appreciate you heading right over after the vote. Thank you so much for prioritizing this moment to be here with us. And thank you so much for just heading over to be with us. So we are so happy to honor you for the work that you do, Senator Murkowski. As you guys know, she's from the great state of Alaska. During her tenure in Congress, she has been outspoken. She's an advocate for protecting the rights of survivors of domestic and sexual violence, something that you guys know that is near and dear to YWCA's mission. Her leadership as the primary sponsor for the Family Violence Prevention and Service Act has played a critical role in the ongoing negotiations to strengthen the rights of survivors and especially for Native Americans and Alaskan women and girls. We at YWCA are grateful for your leadership on issues of gender-based violence and for your dedication to women's health and economic security through your co-sponsoring of the Pregnant Women's Fairness Act. Joining me in honoring Senator Murkowski is my colleague from YWCA Alaska, CEO Teresa Lyons. Teresa, the floor is yours.
Thank you, Alicia, and good evening. It is my honor to congratulate the United States Senator Lisa Murkowski on receiving YWCA's Empowerment Award. Senator Murkowski is an advocate for women's safety, women's health, and well-being. She is currently working to support survivors of gender-based violence and domestic violence, as well as the shelters and the providers that serve them. The Savannah's Act and the Not Invisible Act were 2 bills that the senator led on to address the crisis of missing, murdered, trafficked Indigenous women. She continues to empower others even when she's at home in Alaska. If you were to visit our state, it would not be uncommon to find the senator providing the keynote address at the Empowered Teens Smart Women Youth Conference, where young women are encouraged to overcome obstacles, advocate for their health, and persevere through gender and racial bias to become confident in their own unique voices. It would not be uncommon to find Senator Murkowski celebrating students at Clark Middle School for completing the Leadership Fellows Program designed to enrich the lives of first-generation college students by cultivating academic acumen and personal skill development. I remember a day when a team member saw the senator on the bank of the Kenai River. And we were glad that day that it wasn't uncommon to find our senator fishing because we had a problem that needed to be solved. And yes, even while fishing, our senator helped us to resolve the problem. So as the CEO of YWCA Alaska, I am very proud that our association honored Senator Murkowski with the Women of Achievement Award. She was deserving then, and she is deserving now of this prestigious award. So please welcome Alaska's very own Senator Lisa Murkowski.
Well, I want to make sure I'm off mute, but Teresa, thank you very much for your kind remarks. Alicia, thank you also for the introduction. You remind me though, Teresa, that this is a job where you are on the job all the time, regardless of whether you're wearing a business suit or you're in waders on the river. So thank you for that. But also, I think what is so special is that you felt comfortable speaking with me in, we're not gonna wait and make an appointment. We talk and we help one another. And this is so much of what I think allows us to really come together as communities. I'm very proud of the communities that we have in Alaska. We are rich in diversity. We have extraordinary challenges, but I really do think we try to meet one another as neighbors throughout all of the challenges. So I'm going to thank the YWCA, all that you do in Alaska and around the country to promote women, to advocate for survivors of domestic violence and sexual assault, for all that you do to really address so many of the issues of inequity and racism. Thank you for the empowerment that you provide. And thank you for the honor to be recognized with this Women's Empowerment Award. I think we all have reflected on this past year of COVID, with the challenges that we faced with social isolation, with those who experienced job loss. But I think about so many who were told you need to be in a bubble. You need to stay. Basically, it was like a shelter in place order in so many of our communities. And yet, when you think about that, for far too many women, their home was not a safe shelter. It was not a safe place to be. And we saw the increased levels of violence perpetrated against women and girls. We've seen these levels across the globe. Domestic violence, sexual assault hotlines have increased by 52% since the beginning of the pandemic. We've seen our shelters and our service providers just be overwhelmed. We saw in Alaska last summer, 5 village residents in 5 different communities who died in domestic violence murders across a period of 10 days. You look at these, you read these stories, you look at these statistics, and it just eats at your heart. But I think we recognize that this was not a pandemic-related situation exclusively. Our reality is that for far too long, we have experienced rising rates of domestic violence, child sexual assault. And so, Alicia, you mentioned the work that I have done with missing, murdered Indigenous women, what we've done with the passage of the Not Invisible Act, what we've done with passage of Savannah's Act, working to address this from a systemic perspective. One of the things that I'm working on right now very aggressively is a situation with VOCA funding, the crime victims funds, looking at significant reduction in funds that could dramatically impact the ability of service providers across the state and across the country to serve survivors of domestic violence. So we're working at the federal level to fix this so that we don't see these cuts coming. I'm working on a number of policy initiatives to promote a more coordinated response between the United States and our international partners when it comes to gender-based violence during times of crisis, doing more to provide support to survivors of not only domestic violence and sexual assault, but also those who have been captured in this world of human trafficking. There are so many issues that, again, I think that in a place like Alaska, where some may suggest we're far off the beaten path, we're not far enough to stay away from some of the real dark tragedies that unfortunately we see perpetuated by perpetrators who will go after women and girls. Within the appropriations process that is underway right now, we've just started that effort, but I'm working to make sure that we're addressing funding for trauma-informed programming to support those who have been affected by family violence, domestic violence, as well as dating violence. What we're trying to do, we want to stop the bad from happening in the first place so that these women who become survivors need our support, but wouldn't it be a better place if they didn't have to go through that trauma in the first place? So everything that we can do to end this cycle of abuse is what we need to be doing, working together. And it is through the efforts of so many within organizations just like YWCA, all those who support this very critical mission, that allow women to feel empowered even during the worst times of their lives, even during those times when they feel most at a loss. Knowing that they have access to help is the ultimate form of empowerment. So I appreciate the recognition that's being provided for me today, but I so know that it is the women and men and those of you on the ground every day who are doing that one-on-one reach out, that very personal connection to people, that this is where we're really making the difference. So know that I'm going to continue to work with you hand in hand on these very important initiatives as you save lives one person at a time and truly work to restore dignity and grace to all. So thank you for what you do for so many of us within the YWCA. Thank you so much for this recognition.
Thank you so much, Senator Murkowski, and thank you for your unwavering commitment to the mission of the YWCA and to the communities that we serve and to the community that you serve. Thank you so much for your partnership. Our next honoree is from the great state of well, actually, she is part of the United States House of Representatives. She serves the 3rd District in Kansas. Representative Sharice Davis will be joining us shortly. First, I will bring up my colleague, Kathleen Marker, who will further introduce our rep. Kathleen?
Good afternoon. As CEO of the only YWCA in Kansas, it is my honor today to congratulate Representative Davids on receiving the 2021 Women's Empowerment Award. Thank you for the advancement of racial justice and gender justice throughout your leadership in Congress. On a personal note, I'd like to add that I'm very much looking forward to reading her new book, Sharice's Big Voice, to the children in our Early Learning Center. In your book, you offer this lesson: be open to challenges, work hard and you'll learn a lot, listen to people, but not the doubters. Be open to challenges, work hard, use your big voice to fight for your beliefs, and always remember that you deserve to be seen and to be heard. Indeed, Representative Davids has used her big voice to advocate for issues that are critical to YWCA's and to Kansans, from murdered and missing Indigenous women to climate change to financial relief for nonprofits and small businesses. A champion for expanding economic opportunities for all, Representative Davids has worked to address the pain COVID-19 has caused in Kansas and across the country. And she successfully advocated for legislation to ramp up vaccine and PPE production, put money directly in the pockets of Kansans. She also expanded unemployment insurance to avert a gap in services, get aid to state and local governments to keep teachers and firefighters on the payroll, and to help cover the cost of Kansas expanding Medicaid. The motto of the state of Kansas is ad aspera per aspera, or to the stars through difficulties. The past 15 months have certainly presented our local communities with many new challenges and difficulties to confront. But we at YWCA remain steadfast in our mission of directly serving our communities while radically reimagining the structures and the institutions to create a more equitable future for women, children, and people of color. But none of this is possible without leadership and voice of elected representatives like Representative Davids, who propel our mission of eliminating racism and empowering women forward.
Hi everyone, I'm Representative Sharice Davids. I represent the 3rd Congressional District in Kansas. I am so sorry that I couldn't join you today because it is such an honor to be recognized with the 2021 Women's Empowerment Award. You know, in accepting this honor, I also want to share my gratitude for the many other women who have helped me feel empowered. You know, I'm one of the first 2 Native American women ever elected to Congress, and got to be part of the most diverse freshman class of legislators in history. And we have so many new voices and new ideas and new leaders in Congress right now that frankly just were not represented before and not reflected before. And that's a really good thing for our communities and for our country as a whole. You know, I often find that one of my most important responsibilities and opportunities as one of the few Native people in Congress is to help educate my colleagues on issues that are important to Native communities and brings perspectives that are not always thought of. And it's a lot of folks, I think, find themselves in that kind of position. But whether it's combating the epidemic of and crisis of missing and murdered Indigenous women, or addressing federal programs that impact Native people, or really just helping elevate voices that are not heard often and are speaking about overlooked issues, it feels like a big opportunity and a big responsibility, because it's going to take all of us doing exactly that to get to the progress that we need to see, because we're dealing with a long, complex history of systemic racism and so many other issues that have led to housing issues and healthcare issues. And, you know, we get the chance to raise those issues and make sure that we're seeing investments and federal programs that can address that. And from this platform, I have an opportunity to help do just that. And I cannot tell you what an honor it is to not only get to do the work that I'm doing and help address issues of inequality and inequity, but to be in this with so many of you. I know that so many of you have spent time doing the hard work, and it's part of how a person like me gets here. So thank you so much for all the work you're doing. Thank you so much for this honor. I can't tell you what it means to me. And I hope that soon we will all get to see each other in person.
I'm sorry for the technical difficulties that we may have had with the video. We will be sure to post it online, but we want to congratulate our rep for the award, and we want to definitely congratulate also Senator Murkowski for the awards, and thank them both for their commitment to the mission, and thank you for the commitment to the women and girls in their communities. Now I would like to introduce Representative Judy Chu of California 27th District and Chair of the Congressional Asian Pacific American Caucus, as also known as CAPAC. We will show a short video and I will pass it over to the tech team to cue the video up for us. Thank you.
Hello, I'm Congressmember Judy Chu, and as the chair of the Congressional Asian Pacific American Caucus in Congress, or what we call CAPAC, I'm so honored to be an honorary co-host of today's event and welcome all of you to the YWCA's virtual Capitol Hill Day. And I especially want to thank the YWCA for all the incredible work you are doing to support efforts to advance racial justice, including supporting a congressional resolution to declare racism a public health crisis. This has been a truly difficult year for all of us, but especially for communities of color, as we've dealt with bearing a disproportionate burden from the coronavirus pandemic and a reckoning with our country's history of racism. But every step of the way, the YWCA has been there leading conversations to help more people understand the problem of systemic racism and working toward solutions. In fact, thanks to your hard work to advocate on the issue of anti-Asian hate crimes, we were able to pass historic legislation, the COVID-19 Hate Crimes Act, through Congress with bipartisan majorities in both the House and Senate. This bill would create a new positions at the Department of Justice to help improve hate crimes reporting, and it also includes the text of my bill, the No Hate Act, which will provide resources to state and local law enforcement to improve hate crimes reporting and tracking. And I'm so proud that just last month I was standing behind President Biden in the White House as he signed this into law. Not only will this bill help Asian Americans, but it will help all victims of hate crimes regardless of their racial or religious background. And that's more critical now than ever as we work to address systemic racism in our society. Whether it's addressing anti-Asian hate crimes or tackling health disparities, we know that the COVID-19 pandemic has laid bare long-standing inequalities in our society that we must address. Like other communities of color, Asian Americans, Native Hawaiians, and Pacific Islanders have been disproportionately impacted by the health and economic impacts of the pandemic. In fact, the mortality rate for Asian Americans increased by 35% in 2020 compared to the average over the past 5 years. On top of this, Native Hawaiians and Pacific Islanders are continuing to experience the highest COVID-19 infection and mortality rates out of any racial group in several states. And Asian Americans are also facing higher than average small business closures, as well as the highest long-term unemployment rate out of any racial group, which shows that we still have a lot of work to do to ensure that critical resources are reaching those who are most in need. These are just a few examples, but the health impacts of racism can be felt everywhere, including how communities of color are more likely to be impacted by climate change and pollution, or how prejudice policies and things like housing have created inequality that stretches over generations, leading to less opportunity and worse health outcomes. So it's clear we need to do everything we can to help our country understand the public health threat of racism and how we can work together to address it. And that is why it means so much to have you taking part in this Advocacy Day. Together, I know that we can root out racism and create equal opportunity for all. Thank you.
In the United States Senate. It's a special honor and privilege because of my mother, as you know. to talk to the YWCA and to work with you. And thank you for your leadership in fighting systemic racism. We marked 1 year in May since we learned George Floyd's name. When I last spoke to many of you in April, the guilty verdict had just been announced the same day that 16-year-old Ma'Khia Bryant was killed in Columbus. Those deaths have begun to change our country. I know the YWCA has been at the center of the fights for justice. It's why my mother dedicated so much of her time to the Ohio YW. The coronavirus and racial justice are not separate issues. We know who disproportionately dies of this virus. We know who's less likely to have access to life-saving vaccines, the same people who are discriminated against and targeted while simply going about living their lives. For Black Americans, racism threatens their health, their safety, and their lives every single day. We see it in health disparities, in education and housing disparities. We see it in a justice system and an economic system that too often treats Black lives as expendable. The first step is solving a problem is recognizing its existence. That's why I introduced the resolution declaring racism a public health crisis. That's why you responded. I am so grateful for that. We know, though, this resolution won't solve centuries of racism baked in, no other way to say it, baked into so much of our country. But this acknowledgement, whether it's education or healthcare, whether it's housing, whether it's any of these, that's why our commitment is so important. I remember I held, I'll close with this, I held a round table with 7 or 8 African-American women one day, and I sort of disappeared. I just sort of faded and didn't say anything and listened to them all talk among themselves, and how inspiring and how eye-opening when Black women, regardless of in this group, of their age or their economic background, when they told stories of going to the doctor and doctors looking right past them and not really listening to them as he might have listened to a patient, a doctor might have listened to a patient that looks like me. We know all those things in our healthcare system. That's why the work the YW does is so important. And I'll close with this. I lead a group of 7 senators. I choose 3 Republicans and 3 Democrats to join me on the Senate floor every year in about April to read Martin Luther King's letter from the Birmingham jail. I assume you've all read it. You wouldn't be such a great activist if you hadn't read something like that at some time in your life, but read it again. But Dr. King was critical of ministers, white moderate ministers, who said, Dr. King, be patient. We're for voting rights too, but don't push too fast, don't push too hard. And Dr. King had no time for that. And in this letter from the Birmingham jail, my favorite line in that letter was, Dr. King said, progress never rolls in on wheels of inevitability. Progress never rolls in on wheels of inevitability. When I think of that line, I think of my mother, I think about her work at the YW, I think about all the work you're doing fighting for justice at the YWCA. So thank you, and continue on. We'll continue to work together.
Thank you, Senator Brown, for your ongoing support of YWCAs, not only in Ohio, but across the country. And once again, for rejoining us for this important conversation today. And I also wanted to, prior to Senator Brown's remarks, also wanted to give a shout out and a thank you to, if I could take a moment of privilege, one of my personal heroes, Representative Judy Chu of KPAC. I think this has been a trying moment for communities of color, and the work that Representative Chu has done, particularly with regards to leading the work on the COVID-19 Hate Crimes Act in support and in conjunction with many of you in the audience, our YWCA advocates, has been an important voice in the community this year. So I really wanted to acknowledge these 2 speakers that we just had give us and provide us some critical remarks. But if I could take a word from Senator Brown's remarks, if I could close by saying thank you really to all of our speakers that we had on the panel today, all of our members of Congress, that despite the unending, unexpected vote schedule that we had tossed at us today, really take out the time out of their busy days to really speak about this important issue of declaring racism a public health crisis. So before we conclude, we have 2 final reminders for now all of you, our guests in the audience today. To our congressional colleagues on Capitol Hill, we really are calling on you to take this message, these personal heartstring emotions that you heard from our panelists today, take that message back to your offices. Really embody what they have spoken about, what they have really championed, the issues and the work that they are championing in their communities about how this is disproportionately affecting our communities of color. And please consider co-sponsoring and calling for passage of Senate Resolution 172 and House Resolution 344. As we are now in session and an opportunity to be able to co-sponsor and call for passage is now viable. For our YWCA sisters and our YWCA advocates that are also joining us on the line today, all of our friends, the citizens and concerned activists, you also have a chance to make your voice heard on this important issue as well. The YWCA Action Center is now live. If you go to ywca.org and if you click the Take Now Action button, you are able to write and call your members of Congress on this important issue. We are stronger together in numbers, as we always say at the YWCA, and therefore encourage you to make your voices heard, like many of us YWCA advocates are going to do tomorrow as we converge and paint the hill Persimmon. So a special thanks once again to the Congressional Hispanic Caucus, the Congressional Black Caucus, the Congressional Asian Pacific American Caucus, and the Congressional Native American Caucus for their support, as well as thank yous to Representative Davids, Chu, Garcia, and Senators Murkowski and Brown for their time to address today's audience. This concludes our formal program, and we thank you again for taking the time out of your busy days to join us. We are now asking all YWCA advocates that are participating in Capitol Hill Day tomorrow to head over to the preparation session via the calendar invitation and Zoom links that you received in your calendar appointments. So thank you, and we look forward to seeing you in the next session.